Universal access to antiretroviral therapy remains an unquestionable human right that we all must support. But at the end, we must find a cure for HIV. To ensure effective outcomes to this research, international cooperation will be critical. This includes successful crosstalk between basic and clinical science, HIV and non-HIV scientists, public and industrial sectors, and the key involvement of the community, regulatory agencies, and stakeholders. Realistically, the quest of finding a cure for HIV will require a prolonged period of investigation in many, many areas. However, this complexity should not prevent our effort. Meanwhile, continuous investment to secure universal access to prevention, treatment, care, and support should remain a top priority.
Good morning, everybody. We need to start thinking about the populations who are most at risk for targeted interventions. Then we will need to prioritize those interventions that work within those populations and deliver this in combination with high coverage for us to get high impact. I've seen many presentations in this forum looking at the issues of social and political environment for these marginalized populations that are keeping them reluctant to seek health services. There are legal issues. For example, in Kenya, sodomy is illegal and can lead to a 14-year jail sentence. I know from our media that some of my neighboring countries have harsher sentences for men who have sex with men. They also experience social condemnation, religious intolerance, physical and sexual abuse. We cannot have an HIV revolution without the youth. Data shows us that 42% of new infections occur amongst youth aged 15 to 24. 80%, 4 million youth of these infections are in sub-Saharan Africa. Now, if we targeted this population, think about what a remarkable difference we could make in a couple of years in the number of new infections. In addition to the issue of youth is the young woman who has twice the HIV infection rate that is found in young men. We need to prioritize our activities to be specific to the priority population. And we need to think about their vulnerabilities and address those vulnerabilities and deliver them a comprehensive package specifically designed for the population. Actually achieve treatment as prevention and have impact, we will require very high testing coverage. We will need to improve our linkage to care so that we can achieve community viral suppression to reduce infectiousness and HIV incidence at a community level.
We should abandon the concept of dependency and charity, as well as habitual ways of thinking and acting. We should explore the many exciting new possibilities for collaboration, activism, financing that this world offers. In this environment, the forces that will make the difference are horizontal and partnership-based. The fight against AIDS must be one of shared responsibility and global solidarity between activists and governments, among all countries, independent of their income, and among men and women. And my advice to the global networks: provide outside pressure where useful, but more than anything else, train, support, and encourage concrete rights-based movements and solutions from within, country by country, city by city, and province by province. A truly innovative way of financing could be if the billions of dollars which the United States, the European Union, and other countries occasionally charge in fines to pharmaceutical companies for anti-competitive practices could be set aside for health assistance rather than disappear in the general coffers of these countries. Let us not accept the notion that we cannot find the relatively humble resources to pay for the basic services that mean life for those in greatest need. The world overall is getting richer. we have to make it fairer.
National strategies outline a framework for responding to HIV/AIDS in ways that reflect each country's unique epidemiology, disease burden, and trends. And they demonstrate the importance of country ownership and the need to maximize the efficiency and effectiveness of HIV/AIDS programs. And communities are implementing more creative strategies. Here in the nation's capital, the District of Columbia's Department of Health makes HIV testing available at the Department of Motor Vehicles, so customers waiting in line for a driver's license or other services can get a free HIV test. We know that stigma drives discrimination and disparities. As a result, too many Americans avoid learning their HIV status, disclosing their status, or accessing medical care. To overcome stigma, our efforts include a new Centers for Disease Control and Prevention campaign called Let's Stop HIV Together, which features people living with HIV, standing with their family and friends, and calling on all Americans to join the fight against the disease. This national communications effort will not only address stigma associated with the infection, but also complacency about the epidemic. We must prevent the next generation from suffering the burdens we have witnessed in the past.
Health is a core investment, not only in its central and main purpose, that it is an end goal of human beings to have healthy lives, but also it is an instrumental way to spur economic well-being and economic growth. So investing in health is a very powerful return.
Number one was leadership. They said without leadership, there is no amount of science or discoveries that can ever help, because you need leaders to move the nation, and that's exactly what has happened. So it was very important.
The reason for that shift to change, I think now we are changing our perception about how to respect the people, how to protect the health of people, and respect the human rights, and respond to HIV/AIDS.
I think one more thing that's very important is that everything that we spend came from what we paid in taxes. So 100% of our response is Brazilian. So we're able to produce medication, we're able to produce condoms. We have been giving, in a way, with no strings attached, technical expertise with countries like ours. We have been exchanging that. And 2 days ago, Brazil helped Mozambique inaugurate its first plant that's producing antiretrovirus.
We still face tremendous stigma. Stigma has become a big barrier for delivery prevention, for treatment. We still do not understand how to tackle the stigma issues. That's one of most challenge.
We don't want to lose focus. We are working with most at-risk populations which are totally marginalized. So I think that's a very major challenge, how to converge with the larger health system and yet maintain focus.
I noted yesterday that the 1,200 richest people have a net worth of $4.5 trillion. And so just 1% from 1,200 people would be enough to pay for all of the health financing gap of the poorest countries in the world. That's how odd our world is right now.
About 2 weeks ago, Chinese government announced donation $20 billion to support African countries. That support put HIV/AIDS in the broad context of social development. We do not address HIV alone, so we support African countries, the overall social development.
Working with Resolve to ensure that we bring about an AIDS-free generation. And we believe it is the coupling of the science and technology with the development, expertise, and capacity we have as a country, and we have through our hundreds and in fact thousands of partners around the world that will help us achieve this goal. And we're very, very excited that this is a meeting where we can highlight some of the achievements and opportunities that lie ahead.
There has to be an investment in understanding the true nature of the epidemic within the setting that we're dealing with, within the country or subnational. We also have to understand the social drivers. Now, we've changed that terminology over time, but really it's what drives risk and what blocks access to services. Those are the two key questions. That's social drivers. We also have to have a ruthless respect for human rights.
Make Positive More Positive is designed to connect people around the world who have been affected by HIV/AIDS and demonstrate that with today's advances in healthcare, living positive is a reality. We are urging individuals to define what Make Positive More Positive means to them through art by turning the plus symbol into an artistic symbol of optimism. We can show the world, we believe, what living positively means.
The word of mouth does a lot of magic. And I think for us in Africa, most of the things that have been passed on through oral tradition, it becomes part and parcel of a very, very effective medium of communication. We also need to involve the communities because we need to instill individual and community behavioral change patterns.
We really do need as many of you to lend your voices to this in compelling ways and interesting ways to make it real, to make it tangible for the clients we seek to serve so that they can understand in very simple ways voluntary medical male circumcision is an intervention that reduces your risk of HIV.
I think that Hollywood has come very far in celebrating the gay and lesbian and transgender people in our world and portraying them with respect and dignity. And I think that the thing where we have still a ways to go is to be more instructive within the narrative of how we can stay healthy and how we can be supportive of one another and how the face of a positive HIV status is not a scary one.
At this conference so far, we have heard a great deal about success, about ambition, and about optimism. The idea of an AIDS-free generation, cure, and ending the epidemic. But we must not let these ambitious and hopeful visions cloud what is a crisis that faces millions of people today. A stubborn epidemic of stigma and discrimination against gay men and women and transgender communities. A key driver is homophobia. That there are many opportunities for prevention, but there's a shameful lack of funding targeted towards men who have sex with men. That there are horrific disparities that reveal a catastrophe in our health systems, especially even in high-income countries, and that there is a sense of uncertainty about what we should be doing next.